Hi friends, in this video we're going to be seeing about osteoarthritis. Osteoarthritis, it is a joint disease. So before going into seeing that, we'll see about joints first. Joints are classified into synovial and non-synovial joints. Synovial, the difference between two is synovial joint contains spaces whereas they don't contain spaces. So since it contains spaces, they have wide range of movements. But non-synovial joints does not contain spaces and they have limited movements. Example, cranial sutures. So since this synovial joints contain spaces and they are filled with fluids, they are prone for a lot of infections. So we are going to be seeing this synovial joint diseases. Okay, before going into that, we will see about the anatomical features of these joints. These joints are covered by capsule and they are made up of inner synovial membrane and fibroblastic capsule. Synovial membrane, it contains two types of cells. One is type A, another one is type B cells. Type A cells are also called as macrophages. They are used in phagocytic activities, whereas type B synovial are similar to fibroblasts and they synthesize hyaluronic acid. Okay, and this synovial fluid contains this hyaluronic acid and they acts as a lubricant. We know that. Next, we'll see about cartilage. This synovial membrane is this synovial joint is separated by this fluid and the cartilage. This cartilage is composed of water, type 2 collagen, proteoglycans and chondrocytes. This water and proteoglycans gives resistance to compression and etc. And if you look at it, these chondrocytes, they contain both synthesizing and degradative enzymes. They synthesize matrix as well as degradize them. This is in short about joint. Now we will see about osteoarthritis. Osteoarthritis. Osteoarthritis is an degenerative joint disease. Although the term osteoarthritis implies an inflammatory disease, it is not an inflammatory disease, whereas it is a degenerative joint disease. Since it causes degeneration of cartilage, it leads to the structural and functional failure of the joint, and it is the most common type of joint disease. There is two types of osteoarthritis, primary and secondary. Primary osteoarthritis is the most common and it is related to the aging phenomenon. Whereas in the secondary osteoarthritis, it occurs in the young individual with some predisposing conditions like joint deformity, previous joint injury and systemic diseases like diabetes, hemochromatosis and etc. And it occurs only in 5% of the cases, whereas the primary osteoarthritis is the most common one. Next we will see about the pathogenesis. First, what happens is there might be a biochemical or genetical factors which leads to the chondrocytes injury. Chondrocytes start secreting interleukin-1, nitric oxide and tumor necrosing factor. These cytokines, they trigger the degradative process, and also the chondrocytes produce degradative enzymes. As I've already told, chondrocytes, they secrete both synthesizing and degradative enzymes, but in this condition they start producing more degradative enzyme which ultimately they digest the collagen and proteoglycans that is present in the cartilage, leading to the breakdown of collagen and proteoglycan, resulting in degradation of cartilage, ultimately leading to the loss of the cartilage. Now we'll see about the pathological changes that is occurring in the osteoarthritis. First, cartilage. We know that there is a degradation of cartilage which ultimately leads to the loss of cartilage and matrix. Since there is no chondrocytes, cartilage, there will be a narrowed joint cavity. This is an important feature in osteoarthritis. There will be a narrowed joint cavity which ultimately leads to the limited movements of that joint. Next, in bones. Since there is a loss of cartilage, the fluids in the cavity will try to enter into the bones and there will be a microcyst formation. And also when the bone they involve in the friction, the margins of the bones, there will be a formation of osteophytes. and this osteophytes they sometimes get loosened and they form loose bodies. And also in the synovium, that is in synovial membrane, there might be a synovitis, that is inflammation of synovial membrane. These are the changes that occurs in osteoarthritis. Next we'll see about clinical features. Clinical features of osteoarthritis includes deep achy pain that worsens with the use of the involved joint, and there is limitation of range of movements. As I've said, in osteoarthritis there will be a narrowed joint cavity, so it leads to the limitation of the range of the movements. In women's, most common involvement of joint is knee and hand, and in men it is hips. Okay, and as I've said, there will be a osteophytes formation in the margins of the bones that might involve in the lumbar and cervical nerve root compression, and they may cause muscle spasm, muscle atrophy, and neurological defects. And also the osteophytes may form in the distal interphalangeal joints, and this formation will be called as Heberden nodes, and this is a prominent osteophytes that occurs in women's.